it well. Epaphroditus has an extensive 15-year of working experience in supporting vulnerable children, youth, and families to become self-reliant. He contributed in the development and implementation of the National Strategy for Child Care Reform in Rwanda, including the development and implementation of Tubarere mu muryango. Let's raise them from the family, that's in other words in English. And Ishema mu muryango, proud of family programs. Furthermore, Dr. Epaphroditus Nsabimana has also an extensive working experience in supporting mental health of vulnerable population and in different contexts. He trained government officials and professionals in Uganda, Kenya, Malawi, Zambia, Zimbabwe on issues regarding children protection and children reform. That's all about his biography and his experiences. Maybe you heard of it. So without wasting much of our time, I welcome you. The floor is yours.
Thank you very much. I would also like to mention that this presentation was jointly prepared by 3 other organizations, in addition to Hope and Homes for Children that I'm representing here. Those organizations are University of Rwanda, the National Commission for Council for Persons with Disabilities, and the National Childhood Development Agency. The presentation was prepared. The presentation itself was prepared by myself and Professor Gishoma Darius, who was not able to be available to this session, and Professor Evariste Karangwa from the College of Education at University of Rwanda was also not been able to be present at this session. So I'm going to use my 15 minutes and 5 minutes of questions and answer during this presentation. So as we've been talking, children have many rights, and all rights are equally important. But there is one right which is more equal to others for children. A right which is more equal to others. More equal than others, I mean, for children. And that right is the right to be raised in a family environment. Ladies and gentlemen, distinguished guests, it is the right of every child, including children with disabilities, to be raised in a family environment. We always keep repeating this at Hope and Homes for Children and partners so that our voice can reach as far as possible. This right actually is repeatedly enshrined in many national and international instruments that many countries endorsed. For example, in Rwanda, this right is enshrined in the United Nations Convention on the Rights of the Child, UNCRC, that Rwanda ratified in 1991. It is also present in the Convention on the Rights of Persons with Disability that Rwanda ratified in 2008. And above all, of course, it is also present in the Rwanda Constitution. which is a law above all other laws. It is also enshrined in Rwanda law related to the protection of persons with disability in general, which state that a disabled person has the right to live in the family in the same conditions as others. So children with disability, despite that right, are often the last to be deinstitutionalized in many countries, as I said yesterday. And this is, in many cases, the result of a mistaken belief that is too difficult to deinstitutionalize those children with disability due to insufficient local and family capacity. However, with our own experience at Open Homes for Children and Partners experience, they show that with appropriate support, children with disabilities can fully enjoy their rights with respect to family life. So the process of the institutionalization, which is the one to enforce that right, requires a full engagement and participation of all involved parties, including children, parents, guardians, communities, but also local authorities, institution staff, and others. So knowledge, attitudes, and practices are key determinants of people's engagement in that process. So data on the prevailing knowledge, attitudes, and practices situation is required for a better and effective planning of engagement, implementing and follow-up of child care and protection system reform. For that, a CAP study was jointly conducted by University of Rwanda, Open Homes for Children, NCDA, and NCPD. So we should be actually at the second slide of objectives. Let me do that. And that study was aiming at different objectives, but today we are focusing on mainly the objectives related to evaluating the CAP related to the use of institutional care and the CAP related to deinstitutionalization. How do communities, family members, parents, professionals perceive that process of deinstitutionalization for children with disabilities in Rwanda? So to be able to respond to that question and those objectives, our study design was a cross-sectional study using both quantitative and qualitative approaches. So for this presentation, we'll be presenting some quantitative data we got from this study design. And the study population was estimated based on the National Institute of Statistics of Rwanda, the statistics of children with disabilities, which are somehow not updated, but this is the most recent we can ever have here in Rwanda. And we use a sampling method that you can see there, which, and what is important in this sampling was that we construct districts where there is institutions and another cluster with district without institutions for children with disabilities. Our total sample was 768 participants. So we covered almost the entire country with districts with residential institutions are marked with the red dot in the map, and districts without residential institutions for children with disabilities are marked with green dots on the map here presented. So, most of our respondents were females, 72%, and living in the rural area, 64%, and living in the sector with residential institutions for children, 72% of our participants. And when it comes to the fact that children are, the families we selected have a child who have ever lived in residential institutions, we had a sample where most of them, 73%, for example, have never lived in a residential institution. But also in our sample, participants who had a child with disability who ever lived full-time in the residential institutions were only 5% of our sample, whereas participants, because the participants were parents or guardians of children with disabilities, so participants with children currently living full-time in a residential institution were only 2.1%, whereas children with disability linked in a way or another with a residential institution for part-times were 23.9%. What have we found? So we first wanted to know the attitudes towards deinstitutionalization, and we gave participants a statement, and the statement is the following: I believe we should transition from institutional care for family and community-based alternatives. And as you can see, we had a very high percentage of agreement of people who slightly agree or strongly agree with that statement, 82.6%. While when we take those who didn't agree, who slightly disagree or strongly disagree, we have a very low percentage, 14.9%. So we also asked them to position themselves in line with another statement. I would consider raising my children with disability in family. And we found that almost 91% of participants slightly agree or strongly agree that they would consider raising their children with disability in family, which is a statement or responses that are kind of expected by our study. However, when we asked participants to position themselves to the fact that they would consider raising their children with disabilities in institutional care for children with disabilities, we found that a very high, unexpectedly, proportion of participants stated that they would consider to raise their children with disabilities in institutional care. That's 76%. So we wanted also to know what participants do think would be advantages and disadvantages of the institutional care for children with disabilities. So the most frequent reason or advantage they gave us was to say that in institutional care, there are adequate institutional services, including educational, medical, nutrition, and so on. So, and the least frequent reason they gave or advantage they gave us was that institutions allow both parents and caregivers ample time. But we want also to know the disadvantage on institutional care for children with disabilities. And we found that the most quoted disadvantage was the absence of parental affection in children with disabilities institutions. So we want also to know what are the barriers that participants would state for the integration of children with disability into community life. And the family means or family resources was the first barrier that are that are being the barrier of integration of children into the community life for most of our participants. So we wanted to know the determinants, and with my minutes maybe that is remaining, I will be able to talk about a little bit the predictors of favorability, attitude to the use of institutional care. And we found that, for example, negative attributes for those participants who have a negative attribute to children with disability, they are more than 4 times favorable to the use of institutional care for children. Whereas, for example, those parents who have better parental skills and family capacity to provide care of children are half or less likely to be favorable to the use of institutional care. When it comes to COVID-19, I will state one maybe reason, because we wanted also to know the impact of COVID-19 on care of children with disabilities and on families. Yesterday, I was saying that most of children were integrated during the lockdown into families, but most of parents were telling us that they were, which is expected actually, that they were affected by COVID-19, at least at this with same effect as would be anyone else. So I jump to the conclusion, and I would be saying that as conclusion, yes, the institutionalization is possible for children with disabilities, despite the fact that many parents are in favor of institutional care, and that's a very good entry point for policymakers and practitioners to start engage people so that they can know what and how and when the deinstitutionalization for children with disability can better benefit not only children and families, but also the entire child care system, child care and protection system in Rwanda. Thank you very much.
Thank you very much, Mr. Doctor, for your presentation. And in respect to time, we take this opportunity to entertain two questions in the room, either from the virtual attendants or from Huye. Any question from Kigali? I think maybe I like asking more questions than giving answers. My question is, Mr. Doctor, you talked about this kind of disabilities, and you talked that some of them are intellectual, others are physical. And my question is, if some of the physical disabilities are there, recognize it medically? How about these that are not physical? How do you diagnose this to know that a child is having such kind of a disability? Thank you.
Thank you very much. I'm lucky because here I'm having several of my colleagues at Hope and Homes for Children that work on the field and will be able maybe to showcase the practical examples of such categorization. But what we did in our research was to use a kind of standards that is being at the mode these days, so that data of children with disabilities and categories of disabilities actually can be comparable, not only nationally, locally, but also globally, internationally. And that we used that the Washington Group of Statistics of Disability functionality. So this is the mode. We are talking about the functional level of functionality at the domain like communication, seeing, movement, but also the intellectual kind of level. And that does not require a specialist. Anyone, a parent, a caregiver can himself be given a scale so that he can rate. Actually, the functionality is rated in terms of the level of difficulty. You will be asked, for example, what level your child, what is the level of difficulty in seeing, in communication, in moving. So, and it will be rated at a scale of 4 levels. Contrary to the usually used model, which is medically influenced one of going at the hospital and making a kind of medical diagnosis to say this child has this and that. And I think that this is a very good progress in the area of disability that many social workers and other policymakers can use in the usual daily practices. The Washington Group functionality. It has been adapted not only for adults, but also for children, actually, together with UNICEF. Yeah, that's what I can say, and that's what we used in our research.
Very much, Doctor, for your presentation. Let's join our efforts to thank Mr. Dr. Epaphroditus for the presentation. Let's also take this opportunity to welcome our next presenters. And the reading of the presentation shall be Forum Theater, Impact of COVID-19 on Addressing Gender Equality and Violence with Communities by Dr. Kalim Kopa, Munyerere Bienvenue, and Dr. Leon Oman. You're most welcome.
Ladies and gentlemen, good afternoon. My name is Reimagining. Bienvenue. I am the president of the board of the National Association of Social Workers in Burundi, as well as the national coordinator of a local NGO called Social Action for Development. 60% of employees in that association are social workers, and myself, I'm practitioner, social worker at Hope Africa University. And this organization intervene in social work, especially in child protection, where we work with UNICEF, especially in emergency situation. Currently, we are working with children who were victims of floods in 3 provinces. We work also in gender-based violence, try to fight or to reduce gender-based violence. And there we work with UNFPA in many provinces, as well as in education. So we are here to present a joint working. As the chair said that the forum that we are not going to play here yet, it was already played. And we are going to share with you fundings or the outcomes. It was a project or a joint project between the University of Hull from UK, represented by Dr. Karin Copper, who is not here, and the Institute of Social Work from Tanzania, represented by Dr. Leah Omar, who is not here, and Mr. Yannick from the National Association of Social Workers from the Democratic Republic of Congo. So this project is, we mentioned, it was about forum theater and the targeted street children in Burundi, because Burundi hosted this project, and our organization, Social Action for Development, took the lead of this project. And these street children, as beneficiaries of the project, though they lived at the garbage dumps where they were taking waste materials, it was like their homes. And now, due to this forum theater, we tried to help them, and the project was very relevant to them. It helped themselves and their families. So my colleague Yannick, because due to the time, we are not going all to present. I will give the hand to my colleague Yannick, who is going to tell you about this project briefly. Mr. Yannick, welcome. Tell us, please, about our joint working.
Thank you, Mr. Bienvenu. Hello, everybody. My name is Mubakilai Chinkola Yannick. I'm a social worker practitioner from the Republic Democratic of Congo with several years of experience in working with children and women. I'm also the executive secretary of the National Association of Social Work in my country. I'm a master candidate in social worker. So I will have to provide a very brief overview of the original Forum Theatre project and some of the outcome. I will then highlight the impact of COVID and the challenge faced from both the perspective of the DRC and Burundi. The presentation will end with hope around future plans and recommendations. In 2019, an international team of collaborators, including NGOs from DRC and NGOs from Burundi, from the Social Action and Development Organization, and 2 higher education institutions, the University of Hull and the Institute of Social Work in Tanzania, secured funding through a Global Challenges Research Fund to work with 33 children in Burundi for 5 days using Forum Theatre. The project was foregrounded by the central theme of sexual and gender-based violence and abuse . The project was foregrounded by the central theme of sexual and gender-based violence and abuse, and underpinned by and aligned to the United Nations Sustainable Development Goals. These are health and well-being, education, and gender equality. We identified issues of gender inequality, beatings, and physical and sexual violence by chiefs on garbage dumps and boys using money as a bargaining tool and girls forced to sell their bodies to male garbage collector. The outcomes of the project included by are not limited to the development of a forum theatre group, Hejoni Heza, development of clubs in Burundi using forum theatre, the development of a toolkit used by mentors to engage in income-generating activities, and the follow-up work by social action for development in helping children to grow on food to tackle food poverty and move the children from the dumps. One of the key outcomes was a sense of community, both within the project and following it by mentors and street children. We also published a journal article in the journal Studies of Home and Community Science based on the Forum Theatre project, focused on the Forum Theatre generating a sense of collective consciousness and creating personal and social change. COVID has had a significant impact upon the development following the project. For example, it is noted that there has been mass displacement and violence in DRC, compounded by COVID and in turn poverty. Data from the World Health Organization indicated that between 3rd January 2020 and 26 October 2021, 57,453 confirmed COVID cases and 1,091 COVID-related deaths were recorded. Despite to this, our association in DRC were able to use forum theatre in rural areas to educate communities on how to fight against COVID-19. We were also able to distribute face mask shields to prisons, healthcare centers, and schools in 3 provinces, South Kivu province, Kinshasa, and North Kivu province. And with the support of African Corentia NGO, we were able to support 50 women in Uvira to engage in income-generating activity through agriculture projects. COVID negatively impacted upon the Forum Theatre project developments in Burundi and meeting the Sustainable Development Goals. For example, teenage girls from the Forum Theatre project, due to COVID, were more exposed to rape, and their children were born with unknown fathers and had their basic human rights affected as they were not registered as citizens. We witnessed an increase in the cases of domestic violence, especially especially survival sex. There was an impact upon income generation and poverty as the closure of borders restricted the flow of trade for young people and their businesses. Social action for development were whoever able to engage in a number of interventions, like through 2 awareness-raising projects and hand-washing devices. We trained community leaders and volunteers to monitor positive COVID cases with the support of the British NGOs Street Child. With the support of UNICEF, we continue to work in child-friendly space and community. Going forward, our plans and recommendations are as follows to to continue our focus upon sexual and gender-based violence and address this. In the DRC, we want to commence Forum Theatre work to use as a tool for engagement with various communities. For example, in Uvira Central Prison, to identify and address issues around violence and gender inequality and encourage the development of confidence, self-esteem, and identification of solutions to the problem through engagement with Forum Theatre. In Burundi, we want to continue to develop clubs run by mentors drawing upon Forum Theatre with young people and their communities to build a sense of community and implement community-based solutions. We want to continue to engage with community to highlight and address sexual and gender-based violence and inequality. Thank you for the research team. We are at the end of our presentation, and if there is any questions or comment regarding our research, you are welcome. Thank you.
Great thanks to the presenting team, Mr. Yannick and your colleague. Like they said, they have ended their presentation, but at the end of their presentation, we have also to entertain questions. We are entertaining questions bit from the virtual site, from the room here, and from Huye. You're most welcome with your questions.
Good evening. My name is Alain Mabaye. I can speak in French. Monsieur Patrick, dans le cadre de votre association, quand vous parlez aussi de la RDC, nous avons disposé au Fonds national de promotion des services sociaux les moyens pour promouvoir les organisations qui luttent contre, qui travaillent pour lutter contre les taux de vulnérabilité. Alors, si c'est une association privée, vous devez avoir un bureau, l'autorisation d'installation, l'autorisation de consommation de sièges, le F92, le statut, le règlement d'ordre intérieur, notarié. Vous avez un avis favorable du ministère des Affaires sociales. Vous allez faire une convention de partenariat avec le Fonds national de promotion sociale et puis on vous libère les fonds pour l'activité pour lutter contre les taux de vulnérabilité. Je vous dis et je vous remercie.
Merci beaucoup, Monsieur Alain, pour votre commentaire. C'est juste, j'aimerais vous dire que l'Association nationale des travailleurs sociaux en RDC, ANTS, elle est reconnue devant la loi depuis 2018. Nous détenons tous les documents qui nous permettent de fonctionner légalement en République démocratique du Congo. En fait, nos activités sont basées à l'est du pays. Donc, nous sommes à Uvira, nous sommes à Bukavu, nous sommes aussi également dans le territoire de Fizi. Comme à Kinshasa, il y a déjà une association des travailleurs sociaux. Avec le nôtre, nous sommes en train de voir comment fusionner et avoir un seul corps de travailleurs sociaux en République démocratique du Congo. Merci.
Thank you very much. We are also continuing with entertaining questions. More questions from this room, from the virtual attendants, and from Huye. Okay.
Thank you. I'd like to appreciate, first of all, the presenters. It was straightforward, so very clear. My question is much about how you managed to adapt with COVID, especially knowing that the reaction or the responsiveness of both countries, Burundi and the DRC, was somehow confusing at the very beginning compared to the work trend at that time. How did you manage to make sure you still deliver the message within a context and an environment that has much contradictions? Not sure if my question is clear. Well, thank you.
Yeah, thank you so much. The question is very clear. As you said, really, it was very confused before. Even in Burundi, we could not accept that COVID was there. We still denying that COVID was not there, but after we realized that COVID was there. So it was not really easy, but as a social workers, we tried to make sensitization in the communities to let them know that COVID exists. And we tried to share masks and wash, sanitize so that people can know to prevent themselves against COVID-19. So it was much challenging, but we tried to do what we could do, and we helped our community in that time. So thank you so much.
Thank you very much for your response. Also, one more question.
Thank you very much, presenters. It was very good. And I asked a question. You are dealing with difficult issues like gender inequality, sexual abuse, and as social workers, how do you care each other to be strong and respond to issues? Thank you very much.
Thank you so much. I don't know if there is someone in the room can help to answer this question, because this is our kind of panel. But as a social workers, our role is to help people to solve their problems. What we are doing, for example, today, we are in the first day of the campaign of 16 days of activism. And now we are now celebrating this in Burundi with all UN agencies and the other organizations. And this is our contribution, because it's not easy to let understand that gender inequality, even our community, they don't understand what does it mean. So awareness, try to sensitize people, try to work with communities, administration, so that together we can get solution for this.
Thank you very much. Maybe I can add something to his enlightenment. Based on the context of African philosophy, there is an element they talked about resilience. Being resilient means you will try more times and fail. But failing means it's your first attempt in life. When you fail, say no. If you say no, means the next opportunity. That's maybe what they used. After having failed, after having made trials and fails, they said, no, we have to continue, because it was their next opportunity. Thank you very much. So, without wasting,
I wanted to emphasize on the question raised by Innocent. So I would like to know what was the motivation to work together, Burundian Association and the RDC Association. Do you have similarities about your working mechanisms, or what was the motivation behind? Thank you.
So thank you so much. This year, I can say it was a kind of to our history, if I can say. We met to the first time here at Kigali. It was an international conference of social workers, and we tried to network with many people. And Dr. Karin from the University of Hull was interested in what we are doing in Burundi, in Congo, and in Tanzania. So now it was now a request if we should do something together so that we can make our change as a social workers. And that was the real motivation for that, for this project. Okay, I don't know if Mr. Yannick can add something.
Time is running. I would like to ask more about it because as you are here, you have been invited to Rwanda National Organization of Social Workers. So if you have joined and it was possible, I think also Rwanda organization also can join and the other associations. I have people representing Tanzania and one representing Kenya. Why can't we join our hands and work together? If it is possible for you, you are two countries, why not adding more countries, other countries? Thank you. We should try how to network. Thank you.
Thank you very much. Supplement, make it kind of a supplement. Entertaining the next session of our session, and it reads anthropological perspective of community care to elderly people, then evidence from Rwanda, and this will be done by Albert Irambesha. I think to be presented virtually. Mr. Albert.
Okay, I'm there for the presentation. So, okay. Can you please allow me to share the screen?
Okay, you can share.
Okay. Okay, good afternoon, everybody. My name is Irambesha Albert. I'm happy to present in this conference on Wonu social work. I'm a PhD student at the University of Bayreuth, Germany. I'm going to present my paper entitled Anthropological Perspective for Community Care to Elderly People, Evidence from Rwanda. As an introduction, community care to elderly care have been relegated to kinship sphere in the framework of intergenerational reciprocity. Community care for elderly people in Rwanda has been and remain among the main sources of care to elderly people. However, in the current context, community care is overlooked by researchers. So this paper is going to fill the gap and explore how community care, community care practices to elderly care as they are materialized in everyday life of elderly people. The objective of this paper are to identify different forms of community care to elderly people, to analyze the materialization of community care to elderly people in Rwanda, and to examine how community care practices meet the elderly people's care expectations. The methodology that was used in this paper, the paper draws on data from ethnographic fieldwork in Rwanda, in Western province of Rwanda, especially in Karongi district. The fieldwork was conducted in 2019-2020, and having passed long time with elder people and observing their routine activities and care practices of the surrounding community, has helped to generate data on how community care practices relate to people's vulnerability, as this vulnerability is shaped by social changes. So participant observation, in-depth interviews and field notes were the main tool of data collection for this paper. As the result for this paper, evidence from the field has indicated that there are various forms of community care practices for elderly people, which are mainly summarized in emotional support that consists of the expression of attachment and devotion to elderly people. For example, paying visits to these people and showing that they are surrounded by people who really care for them, as this kind of visiting them help to meet the emotional expectation and to avoid loneliness. There is also the material support that consists of the provision to elderly people of different things and the services that are really needed in the everyday life. The community care practices in the rural area of Rwanda is materialized, as I said, in various activities such as the visits to elderly people, to know about the news, even to greet them, because in Kinyarwanda they say "Mwaramutse iraguma," which means if someone think about you and come to greet you in the morning, that is also a wish of good luck or spending the day in a good mood. There is also the provision of foodstuff, being cooked food, water, and firewoods, as well as transportation to health center, to the hospital, or performing some domestic activities for the elderly people. As we know, elderly people in the rural Rwanda cannot get water for themselves, go down to the hill in a way try to fetch water and going to the top of the hill to collect firewood. And if the surrounding community commit to provide such kind of services, this is appreciated as a materialization of care practices to elderly people. We know also that elderly people are vulnerable to various diseases, and if they get ill, it is up to the neighbor and the community to help them to get to the health center or to the hospital. This is also a support that shows the community surrounding elderly people really care about them. There are also some activities at home where elderly people may need these activities being performed because they are not able to perform all those activities. So all such activities in kind, they are performed by the neighbors or neighbors sending children to help washing clothes or cooking food. This is a kind of materialization of care to elderly people. We have also Umubyizi. This is a Kinyarwanda word that consists of cultivating the land of an elderly person and sowing the seeds in order to assure food security to the elderly person in the future, especially at the time of the harvest. So this is a way of ensuring food security and helping elderly people, making the land productive by growing various crops. A neighbor is better than a far brother. This is a Rwandan proverb that says, "Umuturanyi aruta umuvandimwe wa kure," which means if you have good neighbor, they are better than your brother or your children that are very far, because they are the one that come to you when you have a problem. And this makes elderly people to appreciate the support they receive from the community, from their surrounding neighbors, as this support meets their care expectation, and in somehow they fill the gaps of kinship support. The absence of the kinship support in Rwandan context may be due to various factors. We have these kind of social changes, especially rural-urban migration, that makes a young generation to leave the old parents in the rural area and to go to urban areas for they looking for better opportunities and looking for job. Also, the absence of kinship support is due to the 1994 genocide against the Tutsi that has made the most current generation of elderly people to be without children, because the children were killed in the 1994 genocide. So with this kind of situation, community support to elderly people tries to fill the care gaps, the kinship care gaps. As a conclusion to this paper, community care practices for elderly people makes them to meet the care needs in the absence of the children who are far from them or who do no longer exist. Children that are far from the old parents, they practice distance care, such as sending remittances to them or coming visiting them at some occasion. But those who do not have children, they suffer from that kind of support. That is where the community intervenes. The spirit of sharing resources among community members relates to the Ubuntu philosophy and the Sustainable Development Goals principles of making people, area people having sufficient food as well as accessing clean water and health services. These humanistic values of the community of sharing resources and giving value to elderly people is a way of showing commitment to them and valuing what they have done for the community, the contribution elderly people have made for the community and for the current generation. That's why it relates to the Ubuntu philosophy of giving value to people, of making wealth to people other than wealth in things or in material things. So it makes this philosophy, invites people to share what they have and to value the neighbor, especially those who are no longer strong enough to carry out different activities or to access some services. So the paper argued that care is not a fixed secret that is located in the specific category of people, especially at the kinship sphere. Rather, it is always negotiated and keep adjusting to the changing situation over time. Care practices go beyond the kinship members to include neighbors and the community as a social organization. Thank you very much for your kind attention. Your comment and suggestion as well as questions are welcome. Thank you, Murakoze.
Thank you very much for your presentation. Like you said, if there is a comment, a question, a supplement, you can raise it, and we are entertaining only one.
Thank you very much. My name is Nsabimana Epaphroditte. I really appreciated your presentation. I have one question. regarding the practice that is prevailing in the rural area mostly, but in many parts of the country of Rwanda, I mean, it is still there. The practice of giving the granddaughter or grandson to the elder so that they can help them. Do you think that from your anthropological perspective, do you think that that's benefiting the children first, or do you think that's kind of exploitation of children? Because we understand that elders do need care, but what do you think when that care is being given by a child, a minor? So thank you, that's my question.
Okay, thank you very much for your question. You said that the fact of giving a child to an elderly for helping him, if that benefits the child or if it is a kind of exploitation. Normally, in the area where I have conducted my research, a child is not going to live with an elderly, but a neighbor commits him or herself to send the child to go to fetch water for a small time. You know, in the current situation of Rwanda, all children have to go to school, education for all. So in their free time, a neighbor may send a child to go down the hill to fetch water. This, in anthropological perspective, I cannot qualify it as exploitation. Rather, I can qualify it as a way of cementing relation and making strong ties with the community and with different generation, not only adult person to be attached to elderly people, but also the young generation, because care is practiced over the life course. So the caregivers and the care receiver, they build this kind of social network and cementing social relation. So a child is not exploited. And in Rwandan context, it means that umwana arindwa inzara ntabwo arindwa umurimo, and it goes with this kind of socializing a child on performing some works, especially a child have to perform the works or some activities that are not beyond his or her capacity or his strength or his level of age. So if a child go to the valley to fetch water in a small jerry can that is not beyond his ability, I think that is the good practices of socializing people and teach them how they have to work and they have to abide with all these values of helping others. Thank you.
Thank you very much, Mr. Albert, for your presentation. Let's join hands to thank Mr. Albert for the presentation made. Following the schedule of our session, we are going to welcome the IFSW Secretary General, who's going to share with us this, and we'll be sharing on the 2020 Global Summit and his Rory Troll. You're most welcome, Secretary General.
Thank you so much. It's really wonderful to be with you here again. I've been really enjoying the presentations and the quality and the depth. Thank you so much to everybody. I'm not so much today doing a presentation on what's been happening. I want to do something on what can happen. I'm speaking about a topic I mentioned in the opening ceremony, which is that we have initiated, our profession has initiated a global call for action. And this is called a Global People's Summit called Co-Building a New Eco-Social World, Leaving No One Behind. I just asked the organizers if I can share my screen. I think I can. Yeah, already. That's good. So I share my screen, and I go to the right place, and See if I can move this aside. So I'll just give you in a couple of minutes what this is about. During the pandemic, things started to change for all of us across the world. None of us had plans to work to, of course, so we had to develop plans for working in a different way. And we were very successful at this globally in terms of managing the pandemic, supporting communities, getting communities to be involved in taking responsibility and decision-making and supporting one another. And during this process, things started to change in many countries. We found that we could pick up the telephone and talk to colleagues in other disciplines, in health, in nursing, in education, in police, for example. Where before the pandemic, in many countries, that was really impossible. Picking up the phone, trying to call some colleagues in education or health, they often wouldn't answer or call you back because they work to different policies, they work for different employers, and all, not all, but many countries have siloed social work, education, health, police, community support in different ways. But during the pandemic, what happened was people started to pick up the phone and they answered them and they started to talk with one another. And that happened in many communities, in many cities, and also in terms of my role at the global level. What took place in those conversations is that when we were talking to our health colleagues or our education colleagues, they said, look, we've all wanted to be working together before because we know that in education or in health or in social work, we can't be as effective as when we're working together with the common objectives. And we're only doing so now because we are forced to because of this pandemic. So what's really important for us in our success of working together is not to go back to the way things were, not to return to the old systems when the pandemic is eventually under control. We have to utilize the situation to try and change principles and policies and practice that have separated us. And what I learned personally in talking to my health and education colleagues and other disciplines across the world was that they, like us, are also committed to closing the gaps between rich and poor. They want societies that are preventative. They want communities to be engaged. They want the world to be a better place. And so we started to work together on vaccine justice, on highlighting that the countries with weaker social protection systems and weak social health systems aren't doing so well, and the world's attention must support those. We looked at countries that were doing very well at different times across the pandemic, and saw that when the politicians engaged with the professionals and the communities together, when there was a joint approach to all of this, they did the very best in terms of managing the pandemic. So we started to advocate and work together. During this conversation, the International Federation of Social Workers said, look, why don't we open this beyond the professional groups? Why don't we try to engage all parts of society in this same global conversation? What kind of world do we want to emerge out? What kind of world do we want to be as we emerge out of this pandemic? What kind of values, policies, and practices should we be highlighting as we move out of this pandemic? Now, we immediately got support from the United Nations, right from the top, from Antonio Guterres, who said, in his words, this is a once in a lifetime opportunity for change. If we can't change now, and at this point in our generations that are alive and working on this now, we may lose this opportunity again later. So he stressed a really strong point of urgency in there. So what we've done is we've put out this call and we've organised this People's Summit, a global People's Summit called Co-Building a New Eco-Social World, Leaving No One Behind. And you've got the website in front of you, and here you can see how to access that website in the web address at the top here. Immediately, within the first days of opening this up, UNICEF joined, the World Faith Networks, which represent all the big global faiths. They joined. They want to be a part of it. The global trade unions joined. Lots of different social work organizations joined, lots of different health organizations joined, and collectively, together, these global bodies represent hundreds of millions of people. Fridays for the Future say, hey, we can't join because we have a decentralized structure, but we are with you and we'll have speeches and make contributions. Black Lives Matter joined, not joined, but the same with decentralized structure, but they're very supportive. Me Too movement. So, and actually this is the first time in our global history that we've not only just said that business must not return to normal, but social development must not return to normal. Social change must not return to normal. And so this is the first time that we've got the campaigning global bodies, the professions, the United Nations, and others, even the Commonwealth Organization, Commonwealth Secretariat, all coming into one place and saying, we need this global conversation with the aim that we develop a set of principles that will lead to policies and outcomes that can guide the world forward. A set of new principles for this day, for this time, for our generation, as the old ones, the old ways of working are not working. They're not working. Development has been made, but not as rapid as what people wanted it to be. So this is a call for action for all of us. The challenge we have is to get this conversation, ideally, in every street corner, in every village, in every city. And for every world citizen, for every person in this world to have the opportunity to make a contribution to this Global People Summit. They can do so, they can do it freely. Their contribution will be as valid as anybody else's. And all the contributions will be a part of the program and will be heard in a very large audience. I feel as a social worker, and I hope you feel the same, that we're in a very good position to help communities to bring their perspectives to this challenge. And the words of Antonio Guterres, this once in a lifetime opportunity. There are different ways to make contributions, and you can look through this. You can look through this page. I just have to move the photo out of the way, and you can see there's getting involved and ways to contribute, and become a partner, join the newsletter. There's all sorts of ways for people to get involved. When you open up the screen, it'll automatically adapt to your language, or you can set your language here. We don't want just presentations like academic presentations. People can make songs, they can do dances, they can make poetry. We've got to cater for all cultures in this environment, and all of their different ways of expressing themselves are welcome. What we want is for people to say what policies, what values, what principles make them feel safe, secure, confident for now and for the future. What's going to be sustainable for them? What's going to give them the right to feel strong in their own local environment? And the challenge of the summit will be to pull those together, to develop a list, and from that list, ongoing work. That list is going to be presented to the United Nations high-level political forum, which follows the summit in July next year. And all of those world leaders will be invited to join us, to join this huge gathering to go forward to implement them. So my request, my humble request to each and every one of you in the room, make a contribution yourselves. You've got incredible experience. You work at the intersection of governments, policies, global strategies, and people. You're in the perfect position to do so. And my second request is take your phone and ask the people that you work with in your networks. Ask the people in the communities. Tell them about this. And say, look, would you just mind telling me? You can make a video contribution, or you can make a song. You can do whatever you want. Please, would you be prepared to make a contribution to this huge global process? It would be so welcomed. You can then submit that, or a photo of an image of yourself, a video of yourself. You can submit that through the website, and it will go directly into the program. If you just want to do something just to tell other people you're doing it, that's good too. Put it on Facebook and tag IFSW or tag me, and we'll make sure it goes into the summit as well. We don't want this to be complicated. We just want people to take action. So that's me in my time, I think. And I don't know if we have any opportunity for questions or not, but thank you so much for your time and listening.
Thanks to the Secretary General for the presentation and his sharing. So like he said, now let's entertain some kind of questions, supplements. They are all allowed, maybe, if I'm not mistaken. We can entertain from this room in Kigali, then from Huye, and even those who are attending virtually. Anybody in the room? Virtual attendance, anyone? Or from Huye? Maybe if there is no one, we can continue with our session.
So just a last word, just thank you, everybody. And if you think of questions later or comments later, just reach out to me or reach out to your own association, or to Giacomo, who's Leah, or to Noel Noritzo, or on Facebook, just reach out. I can't stress how important this is. So thank you so much, and wishing you a wonderful rest of the session and day.
Huye? Anybody from Huye? You're welcome. Okay, let's move to the next session, or the next presentation of our session. The next presentation of our session, it reads, Sensitizing Narrative of Lived Experiences by Street Kids in Kigali, City during COVID-19. And this will be presented by Hachizamungu Alexandre and Rutikanga Charles. You're most welcome. Hachizamungu, you're welcome. Maybe try to unmute your microphone. We can't hear you.
Yeah, thank you so much. I was saying that I hope I will be able to share my screen. No, I don't see. Okay. Are you able to see my screen? I hope so. Thank you so much.
We can see it. Go on, please.
Yes, thank you so much for this time. I'm lucky that I'm given this opportunity to present our paper, which we missed the slot yesterday. I was moving between the rooms because I was sharing an office with someone, and when he came in, I had to look for another room. Then when I reached the connection, I wasn't able to present because you had already skipped our presentation. And I hope maybe Rutikanga is in the room. And my third co-author will not be able to be with us because of other duties. Very quickly, when I take the context of our research, is that by the definition of who is a street kid or a street child, is those who spend most of their time in the street or on the street. And those who spend their time in the street, they live there for most of their time, because they don't live even when it comes to night. But for those who live on the street, when it comes to maybe late hours, they go back either to families but they don't stay in the street for the whole period of their time. And this situation deprive children with most of their rights, more especially right to education, to hygiene, to adequate nutrition, to security, just to mention a few. And the idea to do this, maybe it's also worth to specify that it was a desktop research. So the idea to conduct it came when we were discussing. It's kind of a continuation of Rutikang's study, where he was looking at the coping mechanisms of street children in normal times, because his study was done before COVID. And when we were discussing and looking at the findings, I found out that there was hardships of children with who live in the streets. And we're wondering now, how was the situation during COVID, where also other people were not able to do all they wanted to do, and more especially maybe during lockdown, what happened to them? Did they have maybe ways to get what to eat, or to maybe to sanitize in order to keep the to prevent from the COVID contamination? So that was the idea, to see really if there was any research that has been conducted on the situation of street children during COVID hard times, and how maybe they coped with the public health measures that have been put in place to deal with the pandemic. And the aim was just to synthesize the knowledge, and also to draw conclusions from those research that have been conducted, and maybe to identify also gap literature. And the method we used, because I already said that it was a desktop research, We looked into domain research databases because we're more interested in peer-reviewed articles. But also we did not ignore also there are websites of keynote stakeholders who work on street children phenomenon, more especially public institutions, UN agencies, and non-governmental organizations. But we also used the newspapers or newsletters and also social networks. And with these methods, I'm going just to quickly to the findings. The procedure we used to check in the databases to look whether there was a scientific article that has been published showed that there was no peer-reviewed article that we could come across, but we came across to a lot of information on the other platforms that we have used, either the website for the organizations and also the newsletters. And it was clear that 3,096 former street children were reintegrated back in their families on the foster families from May 2020 to May 2021. But among those who were turned back either in the families or in the foster families, 7% of them, exactly 7.3% of them left their families and returned to the street life. And we also found out that according to the Rwanda Social Protection Strategy Plan of 7 years, which runs from 2017 to 2024, highlights some of the instruments that all the stakeholders have always to bear in mind when it comes to intervention of the street children. And those instruments are both international human rights instruments, and some of them have been already mentioned by other presenters, especially the Convention against the Child Convention. We have also regional instruments and the national other programs or strategies that are in place to really deal with the problem of children with, who live on the street or in the street. Among the plans or strategies to prevent COVID-19 contamination, some of them, of course, were displayed either on radio or TV programs. And the more interestingly, we came across a report from UNICEF, which showed that there was a new storybook to help children stay hopeful during the pandemic. And it was really very interesting to know how they really worked out to reach out those children with on the street. But also we wondered now this use of technology, either using, this has come from a non-governmental organization where they used an online meeting or Zoom or Google Meets to reach out the the kids on the street or those who were caring for them. And we were wondering how this was effective to really reach out the big number of the street kids. And more especially when it comes to emotional help or assistance. How was this really done? Because it was only a report of a stakeholder organization, we couldn't really know if the voices of children were heard and taken care of during all those meetings. And we also came across one interesting information that 20% of one of the former street kids who are in the center were vaccinated against COVID. And this also triggered our, we were wondering whether this also reached other kids who were not in the centers, because this is also a key problem to also look into. As I conclude, as I told you, we were interested more in peer-reviewed journals or articles, but we couldn't find any. But more interestingly, when I was following the presentations of the presenters, I thought we could have maybe done this desktop research after maybe the publications of the findings that have been presented by either NCDA, UNICEF, and the Hope and the Homes for Children, because they are having a lot of information which cannot be maybe accessed by everyone. So there are still internal information which has not been published, but since it has not now been published in this conference, I think we'll be able to also access them. And one of the recommendations was that there is a need to really invest in independent research to know really how those children on the street or in the street lived and coped with the measures of COVID-19 pandemic prevention. And I think that's all I have to tell you, and your comments and feedback are the most welcome. Thank you.
Thank you very much for having shared your lived experience. Let's also take this chance to entertain also questions as usual from this room, virtual questions, and from the other room at Huye. If anyone is in the room having a question, a supplement, or a comment.
Thank you very much for the research and for the presentation. It is very good. So I'm sensitive to the concept street children. For me, it is discriminative and it is dehumanizing children. So what can we do? Can't we discuss and share, or you who are at the front of research can help us to make it go with our concept Ubuntu? Because it's like there are children who were born in the street who will live in the street forever. That is my observation. If I'm wrong, you will help me. Thank you.
Yeah, thank you so much, Moses, for your intervention. I think it has been the concept, or the concept street child or street children has been standing for so long, and the sociological studies, this is a phenomenon that has been really documented a lot. But if we can, of course, work together, as I think yesterday I missed out one of the to answer one of the questions which was asked in the chat, when students from no, it was on Tuesday, when students from who were presenting on social work context in Rwanda, there was someone who asked that we're missing maybe adequate names of social work in our own context. So the way we managed to come up with a concept of what social work is in Kinyarwanda, that is ivugurura mibereho, we can also work together to find out what concept now can work better to replace street children instead of, I think in Kinyarwanda we have it. The only problem is now maybe in foreign languages. If anyone can also come in, I would love that. But I really agree with you that, yeah, to call them street children is dehumanizing kind of, yeah.
Thank you. Thank you, Alexander, for representing us. Well, maybe I start with what you have concluded with through the question. I mean, it's a challenge, even calling them street children. They are called very, very many names from different countries. And all those names just come because they don't have a proper name to call these names. I mean, this category of children. They are Landways, Chokora, Maibobo, Laga Pikas, and so many others. The challenge is that they cannot, there is no any term that is appropriate to call this group category of children. Linking this topic with Ubuntu is through the resilience and the coping mechanisms of these children. Actually, they have a lot of Ubuntu. And those, one of the characteristics of these children, they don't move alone. They move in groups, helping one another.
Hello.
During my study, one of coping mechanisms, when one gets food, they share it. When one gets sick, they contribute money to take them to the hospital, I mean, to buy some medicine in the pharmacies. When they go to wash their clothes or play like other children could do, they go together. So this is the resilience and showing the ubuntu in their group, among their groups. So that's what I would mention, but some other things are really very strange because in my study I was really shocked, more especially related to gender, where the big boys lend money to a girl through the other Ubuntu, but that Ubuntu turns into a big violence. Because if they give you 1,000 francs, so it keeps on accumulating after days goes on. Once it reaches 5,000, that girl has to sleep with 5 boys to pay back the 5,000. So it is really a very, very bad experience I encountered that is much shocking. So girls sometimes are exploited in that manner. And those who does it are not the small kids. Those they call them amabandi. These are grown-up street children who are no longer creating the public attention to sympathize. So for them, actually at night, they are in trenches, in the ditches, hiding themselves because the way children might be sympathized, for them, they are no longer sympathized. So that's what I would contribute. Thank you.
Thank you very much for your contribution. I would like also to say something. So 2 seconds. If I'm not mistaken, if we do not combine our efforts to really eliminate this kind of the tragedy of having street kids, now we are creating a room of the future terror. That's so. Let's combine our efforts to solve this problem. Thank you. And the next element of our session is a workshop, and it reads social work in East Africa, Reimagining social work education in East Africa, and this will be done by Nielsen. If it is to be presented virtually, you are most welcome, Nielsen.
Hello, thank you very much. We have actually submitted a video for the conference. So I was wondering whether that had been uploaded.
Let's check with the technical department of ours.
First of all, I can start while we are looking for that to say that we are very pleased to be here. I'm sorry that we have not been able to attend all parts of the conference. And I'm here together with many of my colleagues from Makerere University, from the University of Rwanda, from the Institute of Social Work in Tanzania. And me, myself, I am from the University of Agder in southern Norway. We were asked to submit a video, so we have done that. And I would just like to ask first if that is available or whether we are expected to show that ourselves.
Response from our technical team. They are saying there is no that uploaded video. Maybe you can consult from those you gave a consent upload. And consult from Mayaka. Mayaka, if you're online, you can respond to that. Mayaka? Maybe you can re-upload because it seems even Mayaka is not responding.
Yes, let me confer with my colleagues, Janesse Digenzena and Charles and Cecilia. Perhaps you would like to open your screens, and then I think we would have to do this online in that case. So we are grateful for having been invited to have a workshop with this title, Reimagining Social Work Education in East Africa. And as mentioned, my name is Ann-Kristin Nielsen. I'm a professor at the University of Agder in Norway. And I'm also the project leader of a project called Resilient, building resilient communities through inclusive education in East Africa. And as mentioned, I'm here with my colleagues from different universities throughout East Africa. And what we will do at this workshop is to present some preliminary findings from a research project that we are currently undertaking, where we focus on social work curricula. And the overall question we ask here is to what extent the curricula can be said to be indigenous. And we approach this question through a review of the curriculum of undergraduate programs in social work at our 3 East African universities, that is University of Rwanda, Makerere University, and the Institute of Social Work. And we are also including our Norwegian university for the purpose of comparison. Now, we explore the curricula by looking in particular at the publications with an attention to what language that is used, where the authors come from, and also, when feasible, the context of the empirical data that they rely on. In addition, we look at the gender of the authors, and we include some contextual information about the respective social work programs. As an academic discipline, social work builds on a broad and interdisciplinary spectrum of theories, whereof many can be said to be Americanized or Eurocentric. And we argue that for social work theories to be relevant and responsive to local communities, they have to be contextualized, challenged, and also advanced. And hence, advancement of social work as an academic professional discipline in Africa requires an attentiveness to how theoretical knowledge can be indigenized. And I would also just like to mention that we are aware that the concept of indigenization is contested. And the way we use it, it refers to how social work can be culturally relevant and respond to diverse local contexts. We therefore understand indigenization not as a replacement of dominant knowledge systems, but as weaving together different knowledge systems so that learners can come to understand, develop, and challenge knowledge at large. So from here, I would like to give the word to my colleagues, and I can see that Janestic and Zena and Charles and also Cecilia are here. So please, I don't know who would like to start, perhaps you, Janestic. Are you unmuted?
I can start, but I need to be made a host or co-host for me to share my screen, my slides, or I'll just talk through it. But it would have been better if I can share my slides, the graphics. Is that possible? The organizers, is that possible?
Go ahead and share, please.
Okay, yes. Thank you. Okay, so I'm presenting findings from the research that Anne Christie has talked about, and it involved review of our curriculum to see the extent to which our teaching materials and learning references are indigenized. And just to give you a little bit of background about Makerere University is that I think it has the oldest, social work program in the region in East Africa. The first formal training program opened in 1952. As a diploma, and then in 1969, a degree program was launched at Makerere University. And during the 1990s, with liberalization of higher education, several universities came up and started programs, and currently we have about 19 universities that offer a bachelor's program, in social work. And a key milestone was that in 2018, for the first time, we developed the national minimum standards, for social work education and training, plus a competency framework in a bid to try and, harmonize standards and quality of education across the different universities. And in 2020, Makerere University, which has the oldest, social work program, it's only last year that we launched our first MSW, the Master of Social Work program. So that's a bit of history. And our undergraduate program has been running for 3 years, until last year when we have launched a new curriculum that will require students to study for four years. And the curriculum is revised and reaccredited after 5 years by the National Council for Higher Education. And each semester, students are required to take at least 4 core and 1 elective course. Fieldwork is a core part of the curriculum with up to 40% of the program dedicated to fieldwork, and that actually motivated the increase in the period, of study. And in terms of enrollment, we enroll about 120 students per year. Now, when it comes to reference materials, there's been this discourse and debate about, reliance on Western materials and all that. So we said, let's produce evidence. Let's look in our documents and see exactly what is happening. And we found that most of the reference materials are actually books, textbooks, making up 68%. And then the rest are journal articles and other reports, maybe laws and policies and other, gray literature. And when it came to author nationalities, 51% of all the authors and co-authors came from North America, the USA and Canada in particular, and then 26% is from Europe. So if you add up those, you have 77% of materials, coming from Europe / America, and with only 11%, being authors from Africa. And these authors from Africa, we counted, which countries are contributing these authors. And there were only 9 countries in our current, program document. And out of this, Uganda contributes 68%. And the language used is almost exclusively English. Uganda has so many ethnicities and so many languages, and English is an official language. Right from kindergarten to university, it's the language of instruction. So it's not surprising that almost all the resources are in English. And in terms of gender, the interesting finding was that the males dominate, the authorship of social work materials, and yet, should I call it anecdotal evidence, shows that social work academics and practitioners are mostly women, at least at a global level. Although in Uganda, we still have actually the males dominating the social work profession, both in teaching and in practice, although it is changing, slowly. And finally, the year of publication is, the publications that build on data from the national context were only found to be 18%. And that's not surprising given that most authors are coming outside of, of Africa and of Uganda. And then when we looked at these publications, when were they authored, when were they published? And we found that the current program documents, the majority, about just over half of the publications were published in the last 20 years. And our concern here is that in the last 10 years, so much has been published, so much has changed. And you would imagine that this forms the highest, proportion of materials, but this is not the case. But we are aware of the fact that in practice, as the teachers interact with students, as they, go about their work, they are constantly referring to materials, but these materials are not currently, documented in the curriculum, that you could offer somebody that this is, a curriculum. So this review really was a point of reflection for us, that we must move from just debate and talking about indigenization and decolonization and the need to research and document and actually start doing it and pay more attention to how we, manage our teaching and learning. Because somebody has said, I've heard it said that if it's not written, it doesn't exist. We have to go beyond Africa being an oral kind of community to us academics engaging more in documentation. Thank you so much. And stop sharing. Yeah, back to you, Anne. I don't know who should come next.
Thank you, Genestic. Perhaps we should pass the word to you, Zena.
Okay.
Okay, thank you. Let me also try to share my screen. Yes, Alexander?
Yeah, sure.
Okay. So thank you, colleagues. I would like to join my colleagues to present the findings of our review, also of the curriculum of the bachelor's degree of social work at the Institute of Social Work. My name's Zena Mnasi Mabeo, and I have written this with my colleague, Dr. William Manyama. And we would like to echo what our colleagues have already said. We are conducting a study about the literature that we are using in running our bachelor degree program. To start with, I would like to give you background information about the Institute of Social Work. As my colleague from Makerere said, that Makerere is the oldest university in offering social work in Tanzania. The Institute of Social Work is the first and the oldest institute to offer social work. It began in the year 1974 with offering ordinary diploma program in social work. Then it changed and kept on revising its curriculum. And in the year 1977, we had advanced diploma in social work. In the year 2002, we had initiated a postgraduate diploma in social work, and the accredited bachelor degree programs by the National Council of Education were initiated officially in the year 2006, 2007, when the country had formed a body that regulates higher learning institutions. So we were officially accredited to offer bachelor degree in social work, when the corresponding certificate and diploma degrees in social work in the years 2005, 2006, up to 2008. But the biggest milestone was achieved in our country in the year 2014, when our institute began to offer master's degree in social work. So we have been undergoing various changes, but all these changes were made in order to meet the professional demands, as well as comply with the educational standards of training at higher degree level, at higher learning level. So with regards to the bachelor degree program itself, this is a 3-year program in our country, and it is basically a generalist social work course. It's organized in 2 semesters a year, and so we have a total of 6 semesters in the 3 years. And in each particular year, we have the modules that are organized in core modules, fundamental modules, and we also have some elective modules, particularly in the 3rd year. We conduct some review of our program after every 5 years, but sometimes we also do review in the mid of that particular period. So with regards to the study that is ongoing regarding the literature that is informing our cause, our findings have revealed, of course, we have assessed a total of 315 book literature that is being used, and our findings show that majority of the literature that we use are books, and this constitutes 67.6%. But we also have articles, which constitute 17.5%, and we have others that also in total make up around 15%. So books and articles to the majority of the literature that we use. With regards to years of publications of the books that we use, our findings indicate that majority of the books and the sources of reference that we use have been produced from the year 1990 to date. So this suggests that most of the literature that is being used is relatively current. We have very few literature that we use that is of the years 1950s and 1960s. As you can see, they are represented by even less than 50% in total. We also assessed the language of the publications that we use. And this the fact that Tanzania uses mother tongue or language, business language, our findings show that much in the literature that we use. So the English language, where we find that 99.7% of the literature that is being used in our teaching and learning is in English language. So here we can see how much the concept of indigenization is likely to be constrained by the fact that we not even have literature that is of the local language that is very dominantly and widely spoken in the country. We further assessed the gender of our authors, and findings indicate, as similar to what was found in Uganda, that male predominate the authors of our literature by 66%. We have females by 18.41%, and others that are not applicable, especially this refers to reports that are written by either nationals or international bodies. These are represented by 15%. So you can find, despite the fact that the profession in our country is really dominated, in practice, you find majority of our social workers here are female. And if also in teaching, you find majority of students, more than 70% are female. But when it comes to authorship, the situation is reverse. In terms of nationality of the authors, our findings have confirmed that the majority of our authors are of American and British nationality. Tanzanian authors constitute only 27%. So if you add British and America together with others, you might find that you find that more than 73% of the authors are non-nationals. Furthermore, we also assessed the nationality of co-authors, and the trend is the same. British and America combined constitute the majority of the authors, Tanzania having only 20% of the authors. And if we make further analysis, you'll find that these authors, majority of them are not even empirical literature that inform social work practice per se, but they are national laws, guidelines, and manuals that we use. So if you want to indigenize social work, we still are being informed by this finding that a lot has to be done, needs to be done in order to inform teaching and learning in the country of social work profession. Apart from nationality of the co-authors, we also assessed the gender of the co-authors, and we found that also predominated by male authors. And finally, we also looked at the issues. What are the main issues that are being addressed in the literature that we use? And our findings again show that issues that are being addressed are predominantly of international nature. So you find that issues of national nature do not form the majority in the literature that we are using. So that's all that I have to present in as far as a review of literature that inform social work training in Tanzania, particularly at the Institute of Social Work, is concerned. So I would like to return the ball to my other colleague. Thank you very much for listening.
Thank you very much, Zena.
Excuse me.
Yes.
We request the next presenter to be brief and precise because we have also to respect time. Thank you.
Yes. So I think I cannot see that Charles is here, so I will give the word to you, Cecilia.
Thank you. Let me see if I can share my screen. I have some problem with the techniques here today.
It works now, Cecilia.
Yeah. Well, to compare to a Nordic social work education, I'm at the social work program at the University of Agder. We are situated south in Norway. We have 13,000 students. And at our program, more than 80, almost 90% of the students are women. And we are also represented more women at the academic staff. We enroll about 70, 80 students every year, and social work is one of the most popular programs at our university because health and social science studies enables you to a great extent of different jobs in the welfare state. There are 11 universities in Norway offering this education. It's a practical and theoretical oriented, and it's equal to 180 credits. And it's also regulated by a framework plan for social work education for the Ministry of Education and Research in Norway. And under this ministry, we have this independent expert body responsible for accredited and monitored social work program. We have a lot of laws and regularities like the Norwegian qualification framework for lifelong learning, national guidelines and academic regulations. And this is very specific learning outcomes according to the current regulation of law. This means that there are national standards for the total competence achieved by the end of this bachelor degree in social work to certify and prepare the students to work in different areas of the Norwegian welfare system. And our program has recently been restructured to meet new changes in the society. And it focused basically on social work and in families, groups, and community work with skills and interaction of professional ethics. We also have primary disciplines like sociology, psychology, and legal topics. The curriculum that we present here is 225 different publications. The students also have 1,200 pages self-elected literature that is not included in this presentation. We find that book chapters and books dominates our reading lists with also laws, conventions, and public reports is also a big part of this curriculum. And this is reflected in this gray area here. There is a non-gender publication. When we look at the period of our publication, we see that most of the reading list is after 2010. And the curriculum...
Yeah, we cannot see the slides. We only see the front page of the slides.
Really? Oh, so you haven't seen anything of the presentation so far? Okay. But yeah, we were relying on this. We don't have much time either. So the language publication is mostly in Norwegian. over 80% of the publication is written in Norwegian. That does not mean that the context is all Norwegian. It's based on international research, but the books and the articles is primarily written in Norwegian. And so you also see the nationality of the author's representation. I guess we are short of time. We were relying on this video we have made, so you should have told me earlier that you couldn't see the presentation, but yeah, thank you from Norway.
I'm sorry about that. So I can see now that Charles is on. Are you with us, Charles? Okay.
Hello?
There you are.
Hello?
Hello, we can hear you, Charles.
Oh, thank you. I was out of just the connection. I don't know if I can share my.
Are you able to share, or would you like me to share it for you?
I'd like you to share for me.
Okay.
Okay, thank you. Just not taking much time. You can move ahead. Yeah, we outlined just to present the situation of social work in Rwanda. I will talk of genesis, structure, curriculum, accreditation, and challenges. Can you move? Yeah, social work, in fact, it is a very young profession in Rwanda, and it was introduced as an academic discipline in 1999. Next. Next, please. Yeah, we can, in fact, if we want to talk of social work, refer to two main periods: the period before genocide against the Tutsi and the period after genocide. In fact, it was set up in order to respond to problems emerging from genocide. We can move. So in the aftermath of genocide, just when social work was created, there has been other two higher education institutions that set up, and so far we have 3 higher education institutions. We can move on. At University of Rwanda specifically, move on, and we have just a 3-year program, but before it was a 4 years program, and since 2017, we adopted the system of 3 years, and the module taught in the first year are somehow general and provide fundamental skills, while in second year and third year, professional courses are offered. And also first year and second year, they are just provided with professional English. And all these are coupled with field work that accounts for around 25% of a credit. The total credit to finish this general social work program is 480 credit. We can move. About the curriculum and teaching facilities, we have just physical documentation in the library, and we have online resources composed of articles and book chapters, but you will note that most of them are written in English, and they are Western literature based. We can move on. In fact, that is what I was saying. More than 90% of our resources are in English, but sometimes while teaching, lecturers refer to French or Kinyarwanda for in-depth understanding, but this is flexible, especially in the field. Kinyarwanda is used, and this promotes just the implementation of the homegrown solutions. I mean local practices. We can move on. The program accredited from the Ministry of Education through higher education institution, but there is a body in the country dealing with professional health professional organizations, and social work is included. So this body, in collaboration with higher education institutions, help our graduates just to be accredited. Moving to the last slides, Anne, you can talk of challenges and perspectives. The key challenges concern the fact that the program is still mostly referring to Western models. We have a lack of enough permanent qualified social workers. Fortunately, now we have around 5 PhDs, 2 are completing within 2 years, and others are in Sweden. They are just in their first year, but in the coming years, it will be easy and to set up a master program. We have a lack of professional supervisors, especially in the field. So the field practicum somehow is not well equipped, and to fill the gap, the academics collaborate very often with community practitioners, and we have set up what we call advisory committee that composed of people from the community, and this helps us, we think, to improve more in the coming years. Lastly, you can just move on, Anne. We have perspectives, and these are especially to ensure that social work plays a developmental role and empowers people, particularly the vulnerable, so they are involved sustainably in the problem-solving process. We have also to equip our students with adequate theories, but these theories may fit local practices so that we promote and we document our indigenous practices. So we hope to address all forms of adversities and moving towards sustainable development by involving all segments of the population, particularly the youth. I think I can stop there, but maybe you can see these images and you can put them. We are relying on our young people to work together, but women also with the light of hope, we think, and with the last quotation, last slide from our president, whereby is saying development is not about money or machines or good policies, but it is about real people and lives. So we have to see how our people are well equipped, they become knowledgeable, skillful, but relying upon our local practices married with Western practices. This will help us to indigenize. I thank you. This project will help just to improve all this. Thank you very much to listen to me.
Thank you very much, Charles. In our video, we had a final reflection by our colleague Eric Ochen, but since we are out of time, I think we will just leave the floor open for questions and comments from the audience.
Thank you very much, Nelson. Let's check if we have some kind of questions here in the Kigali room.
Thank you very much. I am Alexander Nizimana from University of Technology in the Art of Byumba. I was somehow challenged by the concept indigenous, which normally based on traditions, and tradition normally are well expressed through local languages in mother tongue. And based on the result findings you presented, most of findings are in English. How will reach the level of expressing people's feelings using the local language? And what can you advise to teach social work in local language? Or please, it's your time to help us. Thank you.
Thank you very much for that question and that comment. I think you are perfectly right. It's seen from a Norwegian perspective. It's quite interesting to see that all the literature is in English in these, or at least most of the literature is in English in these at these three partner universities. I think Zena, Genestic, Charles are better fit to answer the question than I am. So please go ahead.
I think you are right. And Janestic, she wrote even about this in different articles. I think she is well placed to give the answer. Dr. Janestic.
Thank you so much for that question. I think it's a very outstanding challenge. I mean, you notice when you're teaching students in English and really the concepts cannot be grasped because that's not their language. They think in their language. They want to express themselves in their language, even the teachers themselves. But then maybe it could be much easier in a country like Rwanda or Tanzania, which have a national language, known across the board. But when it comes to, really, I don't think there's any reason why we shouldn't use, Kiswahili in class or Chinyarwanda in class, and I believe you do it. But when it comes to Uganda, it's a challenge because we don't have a national language. Even when we are doing casual conversations amongst ourselves as faculty, we just have to stick to English. So unless the political economy, the languages changes and all that, it's going to remain an outstanding challenge. But there could be innovative ways, of helping ourselves and the students, try to grasp, for example, giving an exercise for students and for us to think about what do you call social work in your language? How would you, present this in your language, and what does it mean, so that we take it from this English textbook, even English article, to the day-to-day lives and meanings in students' contexts. That's all I can say.
Thank you, Dr. Janesti. Thank you, presenters. I heard you talked about very few universities that are offering social work courses. Starting by Uganda, you only present on Makerere, but I know you have many universities in Uganda offering the courses of social work. I don't know why you just only stick on Makerere, while you have many universities offering the courses of social work in different degrees and diplomas. Even in Tanzania, you have School of Social Work, I know, but you have also the Open University of Tanzania, you have University of Dar es Salaam, you have many universities offering social work. In Makerere, in Kampala, you have Kampala University, the two Kampala University, one Kampala University, Kampala International University, other universities offering social work. But you just talked on only one, the oldest university, which is very known worldwide, Makerere University. And you, Zena, you talked only School of Social Work. I would share with you that we have we have a kind of gratitude to your countries as far as education, social work education is concerned, because many lecturers of social work in Rwanda graduated from your countries, your respective countries, many from Uganda and others from Tanzania. We have nowadays, Charles presented only University of Rwanda, but we have, currently we have 3 Rwandan universities offering BSW. So, and we are heading to masters nowadays. I know University of Technology and the Arts of Byumba, Catholic University of Rwanda, and even University of Rwanda have already developed the program of masters of social work. So I think it's better, it's good to mention it. It means that we will no longer come back to your countries to study, to look for master's program. Okay. Because we are ready to start our only masters. I think the next years programs have dropped, and some universities have sent them for accreditation to the Ministry of Education. So I would like just to express my gratitude to your countries, both of you. You have contributed to social work in one way or another in Rwanda. Thank you very much.
Thank you.
Yeah. Maybe I can just have a quick response to your concern. Why didn't we extend review to other universities? We did mention there are many other universities, but we did this as a pilot within the institutions that are making up, are collaborating in this project. It's a new project. It was a quick review, so we limited it to our own institutions, but previous engagements with universities in Uganda, have shown, I think 2018, when we were working at the minimum standards, have shown that we have very, very shared kind of challenges when it comes to indigenization and decolonization of the curriculum. Thank you.
Thank you very much for the presentation. I also want to ask something, if I'm not late. You talked about a barrier to really implementing this context of the concept of Ubuntu, because you said at least we are blessed, we Rwandans, because we have one national language, and Tanzania. Then you said Uganda, it's not possible because you have multi-languages, if I'm not mistaken. Then actually, I believe based on the context of this concept of Ubuntu as African philosophy, and most of our countries have multi-languages, how are we going to do this to maybe to minimize the use of English in implementing this concept of Ubuntu and its elements? I would like really you to maybe enlighten me, how are we going to do this? Because mother language is something that dominates in most of the African countries. Thank you.
Yeah, maybe my colleague can, Zena or Charles can come in. Zena?
I actually have no one single response to the question, because we come from different countries with different orientations. And for instance, in the context of Tanzania, where we have Swahili as a mother tongue, I think history has made us be where we are, because you can find that in the training of training system, we learn English at grade 1 up to 4. We learn Swahili from grade 1 up to 4, but from there we introduce English as a language of a mode of instruction. So even that, by the virtue of the fact that we teach to children 2 languages, it even sometimes causes complications to the matter. So I think the strategies would differ from one nation to another. In our context, we are now trying to promote Swahili in a number of ways. So I think that can help in introducing, in fastening the process. But in other contexts, like in Uganda, as Janestic has said, the challenge can be big, especially when you do not have a common national language apart from the English language. So it's something that is not quite easy, but we still believe that even within different communities, there are certain common practices that can still be used and applied within different communities that can be brought on board. So I think what we need to do is just to analyze, to conduct more studies and find out what are the indigenous modes of practice, in whatever language they may be, but what are the philosophies in those modes, and how can those philosophies be integrated into the training of social work? So that would be the starting point. But in as far as languages are concerned, I think it is a matter that requires quite a lot of discussion at national levels, and that would not have one single answer to that.
Just one word to add. I think referring to Ubuntu, it's a matter of feeling united and acting as one person. Whatever the languages we are speaking, it's a matter of being united by promoting our cultures and to make a choice. If we have chosen to study, for instance, French or English, all categories of people in our countries have been capable to learn these languages. So one day or another, with especially the new generations, it is not a thing that can be done in one day. They can select and find a common denominator by teaching and learning one language. I can stop there. Thank you.
Thank you very much for your supplement. As we come to the closure of this session, I would like to thank everybody who tried to participate and those who tried and failed, maybe because of other inconveniencing circumstances like networks and whatever. So I would like to invite my colleague here to come and maybe say something as we close. Thank you very much. My name is David. I'm a student at the University of Technology and Arts of Byumba. I'm glad that even one of my mentors did something of a presentation. Thank you very much.
Thank you, David. Thank you, the audience, for attending today's conference. It was a pleasure to be with you again once more. We are heading to the end of the conference. That will be tomorrow. But thanks again to the technician. Today it was somehow perfect. We didn't meet many challenges in regard to technology. That is wonderful. I hope it will be the same tomorrow, because tomorrow we receive the guest of honor, minister, to close our conference tomorrow in the afternoon. So I welcome you tomorrow once again. As it has become a habit, you know, you have to arrive at 8 because we start at 8:30 top. Then if technology is good, like it has been today, we'll start at 8:30 top. Then we proceed with presentations. Thank you, everybody. Thank you, presenters from abroad. Thank you, Dr. Janestic. Thank you, Professor Zena. I remember you in the last conference, you were here physically, but you could not make it due to COVID, I think. Once again, I thank you. Thank you, the team leader. I don't know the name, team leader. Okay, thank you very much. Goodbye, see you tomorrow.